Hey everybody, Dr. Barron here with virtualheadachespecialist.com. You know what, we are unfortunately getting into cluster headache season, so I want to just give a couple differentiations between these types of headaches because I see a lot of patients that come in with a diagnosis of cluster headache, and often it's not accurate. It's many times migraine. So there's a lot of confusion between these. They both have overlapping features, but there's some key differences, and so it makes it very easy to pick them out. First key difference is the duration of the attack. So cluster headache, untreated or unsuccessfully treated, should last anywhere from 15 minutes up to 3 hours at a maximum. So if your headache is going on all day, hours and hours, not cluster. It just does not do that. If it goes more than 3 hours by criteria, it is out of the criteria. Migraine, on the other hand, goes 4 hours or more untreated or unsuccessfully treated. So that's one key difference. Another key difference is the frequency of the attack. So cluster headaches can happen every other day, up to 8 attacks in a day. Migraine just does not do that. Migraine is usually going to be a one-time event in the day. If you get the attack, it's usually there. Hopefully it breaks, after a number of hours, hopefully sooner than that. But it's not something that is going to come and go with discrete pain-free periods in between multiple times in a day. It just does not do that. Cluster headache usually happens in a pattern, so it may be around the same time every day. Overnight, it wakes the person up, say 2 a.m. every night. They wake up with this severe, debilitating pain. So there's often a pattern to it. Migraine, you can certainly have waking migraine, but there's not as consistent of a pattern typically. Cluster headache is called cluster headache because these attacks come in clusters. So they often happen in season changes, from summer to fall, from winter to spring, and they may be pain-free all year. Season change comes and boom, they start getting these clusters of attacks, multiple attacks through the day. These cycles may go 2-3 months, hopefully not if you break the cycle, but they often can do that, and they're clustered together, which is why they call it cluster headache. And then once the cycle breaks, headaches are gone and you're done. So those are some of the big pattern differences. Migraine can certainly have some weather-related seasonal change flares, but it's not as consistent of this packed-in cluster attacks that happen like that. Some other differences is that migraine and cluster, they both can be one-sided. Cluster headache has to be one-sided, around the eye, temple, up in that area generally, and it's intense pain. They call cluster headache suicide headache for a reason, because it's really severe. Not that migraine isn't, but it's really another level headache. Often described as like a hot poker through the eyeball. Intense pain. The other thing is that you have to have autonomic features with cluster headache. You can certainly get these with migraine, but they tend to be very prominent with cluster headache. And so these are things like puffiness around the eye, droopiness of the eyelid. The pupil may get smaller on that side. You may get stuffiness, nasal congestion on the one side, runny nose on that side. It's usually pretty significant. People describe it pretty prominently. There may be some flushing on the side of the face of the pain, and all these happen on the same side of the pain, obviously. The other thing is that most patients with cluster are very restless. They're very agitated. They're rocking. They're pacing the floor really quick. Versus migraine, which is usually kind of locked, dark, quiet room, want to stay still, don't want to be moving around. So that's often another key difference. But I think the big top two differences, if you just look at the duration of the attack and the frequency and the pattern of the attacks, those two things are really the key differences between cluster and migraine, because the other features tend to be more prominent with cluster, but you can have overlapping features between migraine as well. So just wanted to mention those things because I know cluster season's coming up, and it's a miserable time for people. So just wanted to spread that info. All right, guys, have a good one. Bye.